All right, so thank you very much. And I'm thrilled to be presenting today as part of this conference. My name is Gavin Goodwin, and I'm currently a candidate in the Master of Information Studies program at McGill University. Today I'm presenting on my paper, Social Media, Grindr, and PrEP, Sexual Health Literacy for Men Who Have Sex with Men in the Internet Age. And the full version of this paper will be published in the forthcoming issue of the Journal of Consumer Health on the Internet. Before beginning my presentation, I'd like to make a land acknowledgement, recognize that McGill University is situated on unceded Indigenous lands, territory of the Kanyakehaga Nation. Tiohtià:ke, otherwise known as Montreal, has long served as a site of meeting and exchange amongst nations. I'd like to recognize and respect the Kanyakehaga as the traditional custodians of the lands and waters from which I'm presenting today. So I'd like to offer some background on key elements of this paper, including HIV in groups at high risk of infection, like men who have sex with men, current HIV treatment and prevention interventions, and the influence of geosocial networking apps like Grindr. So throughout the ongoing struggle against the HIV/AIDS epidemic worldwide, and with new advancements in treatment and prevention, higher incidences of infection and transmission of HIV continue to be reported among high-risk populations like men who have sex with men, or MSM. Of the new HIV infections in Canada reported in 2018, 58% were among gay, bisexual, or other MSM. Health Canada reports an estimated 75,500 Canadians currently living with HIV, and approximately 1 in 5 of whom are currently undiagnosed or unaware of their HIV status. Despite the overall decrease in HIV cases among industrialized nations, MSM rates remain high even with targeted health interventions for high-risk groups, highlighting the difficulties in the transmission and propagation of credible and engaging consumer health information concerning HIV prevention and treatment. Within the past decade, new biomedical interventions have changed the reality of many who are at risk of HIV infection through reducing the rate of transmission with strategies of treatment as prevention. These strategies include the use of antiretroviral drugs to achieve undetectable viral loads in HIV-positive individuals, and the use of once-daily oral pre-exposure prophylaxis, or PrEP, to prevent new infections in HIV-negative individuals. While clinical research about the effectiveness of PrEP is ongoing, current findings indicate a high degree of success with up to 99% effectiveness in preventing the transmission of HIV when PrEP is taken daily. Despite the mounting scientific evidence about the effectiveness of PrEP, uptake rates of the drug remain slow, with estimates by the AIDS Vaccine Advocacy Coalition placing the number of PrEP users in Canada in 2020 at approximately 4,700 to 5,200 people. Concerns about the efficacy of the drug, cost and availability, side effects, and risk compensation concerning sexual behavior are possible indicators for the slow uptake in the drug, leading to a need for effective consumer health information to help assuage fears, counter misinformation, and spread awareness to increase uptake and maintain effective drug administration. While smartphone applications have been developed with the goal of offering information about HIV and other STI transmission, the infrequent app downloads, inability to reach large numbers of high-risk people, and overall poor reception and reviews has led public health campaigns to use both social media platforms and popular geosocial networking, or GSN apps, to reach high-risk MSM populations. GSN smartphone apps such as Grindr, Jacked, Scruff, and Growler, among many others, allow MSM to connect through an online social platform to find sexual partners based off of geographic proximity, with these apps gaining popularity since their first emergence approximately 10 years ago. The most popular of these services, Grindr, has reported over 2 million daily users worldwide, and due to their influence in interpersonal and sexual relationships among MSM, these apps present a fruitful opportunity for communication and knowledge transfer concerning HIV prevention. Alongside GSN apps, the widespread use of social media platforms like Facebook, Twitter, and Instagram present possible mediums for the spread of HIV health information to MSM groups that are more difficult to reach, allowing repeated exposure to messaging and offering the possibility to disseminate information to large numbers of people at once. Examples exist of widespread meme culture among the queer community, with frequent discussion of PrEP and HIV, and many social accounts have large number of followers and can reach an even wider audience through the resharing of posts. This image, the screenshot, is from one of the most popular meme accounts I follow on Instagram called Best of Grindr, and it has about 2.5 million followers. The account is not officially affiliated with the Grindr app, but instead addresses issues like hookup culture, use of apps like Grindr, and issues concerning the queer community like PrEP and HIV through the sharing of humorous videos and photos. Many accounts like this exist on both Facebook and Instagram, with other social influencers filling similar roles on platforms like Twitter, Snapchat, and TikTok. These social accounts and meme culture were the starting points for my investigation of this topic, as often the discussion of PrEP use is framed in these memes with the concept of risk compensation, where someone taking PrEP would be empowered or would feel empowered to undertake riskier sexual behavior because of their use of PrEP and reduced threat of HIV infection, often at the expense of protecting themselves from other sexually transmitted infections. So this personal curiosity led to developing 3 research questions, which I framed my research and this literature review, including what is the efficacy and acceptance of delivering consumer health information about PrEP and HIV prevention through GSN apps? What is the impact of online and social media communities in the discussion and delivery of health information about PrEP and HIV interventions? And what are ongoing and possible future research areas concerning this topic, and what's the role for information professionals? So to start the discussion of the research findings, we'll present on HIV and PrEP information through GSN apps. The reception of sexual health information for MSM using GSN apps has been positive, with high overall acceptability and encouraging trends showing that these interventions are generally well accepted and well received regardless of socio-demographic variables like race, ethnicity, age, income, education, or geographic location. Community feedback describes favorably the incorporation of sexual health sections and advertising banners within GSN apps, and the frequency of information delivery, including both information actively sought out and weekly push alerts. Information concerning PrEP is among the most accepted types of information, which offers encouraging evidence to continue health messaging through these apps, especially in rural or less centralized urban centers that don't have as equal access to sexual health resources. So the literature review discovered varying studies on this aspect from different geographic regions, including Australia, Canada, India, Switzerland, the United Kingdom, and the United States. Several emerging trends and best practices were identified for this type of app messaging. These recommendations include the ability to distinguish legitimate health information from spam or fraudulent messages, a focus on reaching populations outside the traditionally predominant gay social spaces, and avoiding stigmatization of groups solely by targeting higher risk demographics like young MSM or racial or ethnic minorities. Timeliness of information delivery is a noted benefit of the apps, though information should not hinder the experience and enjoyment of meeting sexual partners. Information offered should remain both engaging and sex positive. Avoid overly clinical language and work to build a culture of precautionary social norms, and should be delivered by authoritative and trusted information sources. Also, the geolocation functionality of the apps offers great potential for providing geographically tailored information about local resources and testing, though caution should be exercised to avoid the perception that too much personalization is intrusive and violates the privacy of users, especially in regions where public disclosure of same-sex sexual activity carries individual risk and could be dangerous or impact personal well-being. So next, I'd like to present on the impact of social media on the discussion of sexual health in online communities. While GSN apps have a significant reach and impact among high-risk MSM, they do not have the universality and ability to reach a broader range of people as does social media. The ubiquity of social media allows sexual health information to reach more diverse populations while being cost-effective and easily scaled up, and allows for repeated exposure to information with built-in user feedback. As well as helping to encourage direct engagement between information seekers and providers. Possible tools for social media interventions include crowdsourcing, pop-up ads, establishing virtual communities, online counseling, education and FAQ forums, and referrals for STI testing. The potential held by social media is important not only for the dissemination of information, but also as a possible source of study and data for researchers looking to understand the information behavior of those searching for, consuming, and sharing health information online. This includes if and how the information and sentiments being shared are aligned with those of public health priorities, as well as identifying unique and beneficial messages that could be amplified and propagated with support from health information professionals. The literature review has also revealed useful insights for how each of the major social platforms are being used. Studies analyzing HIV-related hashtag trends on Twitter highlight the platform as being used primarily for the sharing of general health information and news rather than personal expression and discussion, as well as noting the limitations of targeting specific high-risk groups due to the character limits of tweets, which forces a trade-off between target specificity and how information-rich the communication can be. A similar analysis of visual content on Instagram found that most social media posts and discussion concerns infographics and stigma reduction about HIV, and little about clinical interventions, PrEP use, or general public sexual health priorities. Facebook is perhaps the most successful in both delivering and sharing sexual health information due to its ubiquity and participatory features and networking capabilities, which helps foster a sense of solidarity and community with great success found through the use of popular opinion leaders and peer mentoring in online Facebook communities. When dealing with information concerning sexual health and HIV especially, the sharing of experiences through traditional channels can be difficult for individuals due to a reluctance to disclose sensitive personal information. The perceived anonymity offered by social media allows users to discuss sexual health issues with online social circles with less fear of stigma. And understanding the different kinds of personal sexual health information that is shared online compared to in-person with clinicians and practitioners can serve as a valuable data source for tailoring future consumer health initiatives for HIV. An example of this kind of research from the literature includes determining kinds of barriers to the increase in PrEP use among high-risk MSM. Examples of the kinds of barriers discovered include online ordering of PrEP, HIV and gay stigma, issues of perceived promiscuity of PrEP users, side effects of the medication, sexual risk compensation, experiences with poorly informed healthcare practitioners, and opinions on the pharmaceutical industry. So understanding online trends in sexual health and HIV discussions can allow researchers and consumer health providers to move beyond merely using social media as a way to disseminate information and instead leverage the interactive capabilities of the platforms to encourage participation and self-motivated interest in HIV prevention and sexual health. Encouraging active contribution of social media posts compared to simple observation and endorsement has shown to be an effective strategy in increasing testing and awareness online. Social media posts encourage people to share experiences and information and can trigger others to do the same, which in turn can increase the use of medication, help reduce anxiety, and allow the sharing of rapid solutions to problems through impromptu virtual support groups. So an online presence for consumer health information providers in these virtual spaces, delivering accurate and relevant information in response to these online expressions of need is a powerful possibility for information delivery. And finally, through this research, there are a number of ongoing and possible future research directions, and as well as highlighting the ways information professionals might be implicated. Further research can be conducted into best practices concerning targeted HIV health information and the information behavior and preferences of minority groups of MSM. There are indications that MSM of color tend to be the most assortative in their sexual partners when using GSN apps and require more specific geographic and community level interventions to achieve the best results. Conversely, the explicit targeting of groups like young Black MSM through GSN apps leads to potential stigmatization of an already high-risk subgroup of MSM. So further study can be conducted to uncover the best messaging and information delivery strategies of online health information for specific vulnerable minority populations. This also includes those involved in transactional sex work, for example, who tend to be at higher risk and are less likely to be reached through GSN apps or social media. The slow uptake in PrEP use by high-risk MSM has revealed a knowledge behavior gap between awareness and willingness to take the drug, compared against how many individuals are actually taking the drug regularly. Studies range with results from 1/3 to as high as 3 in 4 MSM being aware or willing to take PrEP, but with actual regular prescribed use of the drug being much lower, usually around 6 to 12%. So in addressing this behavior gap, the use of information behavior models, modifying existing models, or the creation of new ones is an important direction for future research to help address this disparity. And for long-term research opportunities, they can include the continuation and replication of existing studies in more diverse geographic and cultural regions, longitudinal studies examining and clarifying the relationship between information behavior changes and shifts in HIV or STI incidences in high-risk MSM populations, And finally, more comparative studies between MSM using GSN apps and those who are not, and their differing information needs and behaviors. So this paper was an initial foray into this research area for me, and I found several interests, personal interests for future exploration. These include pursuing research with text mining and semantic analysis of social media posts and comments concerning PrEP use and HIV prevention in an effort to better understand the sentiments held by MSM social media users. This could lead to better information on how to address the knowledge behavior gap regarding PrEP use, as well as better understanding where and how to better target consumer health information posts on social media. I'm also interested in a closer examination of the use of popular opinion leaders on social media and their role in disseminating health information. Understanding the knowledge transfer and codification processes with these social media users could help lead to better training and guidance from health providers for those filling these roles online, as well as understanding why peer mentoring might be more successful than direct interventions online from consumer health providers. So thank you very much for your interest and attention.
Thank you, Gavin, for that nice presentation. Quite interesting. So do we have any question?
In the chat.
Okay, in the chat, yes. All right. So, okay, this question is from Vera. So it says, could you talk a little bit about the review? How many studies were included and from what countries?
Yeah, absolutely. I'm just trying to pull up the number. It was 42 studies that were included. And most of them were from Western industrialized countries, primarily focused on the UK, Canada, Australia, and the United States, although there were some examples from elsewhere in the world, notably some studies from India. And the literature drew from mostly medical information technology and information science databases. So inclusion in the literature review required some kind of focus on the use and implementation of PrEP for high-risk populations, some kind of study of GSN apps or social media-based health information interventions, as well as looking at a fairly recent publication date. So within the last 10 years, seeing as that's the time frame where these GSN apps have been around and the most popular.
Okay, says thank you for the answer.